Hello and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Anna Popper. Today's episode is part of an ongoing series on addressing key challenges in the management of viral hepatitis. This series features conversations between a patient and a clinician where they discuss developments designed to improve access to treatment and care of patients with hepatitis. In this episode, Dr. Paul Kuo of Stanford University talks with Jason, a patient with chronic hepatitis B and HIV co-infection who lives in New York City. After his diagnosis, Jason returned to his native Kansas City, where getting medical care proved to be more difficult than he imagined, the beginning of a series of personal challenges he would face and overcome. For more information about our guests, and for a link to additional online education on this topic, please visit the link in the show notes. So let's turn it over to Jason and Paul.
Well, I was diagnosed in 2011 here in New York City. And so in 2013, I had moved to my native area of Kansas because my mother was sick and she had died. And so I had moved back there and only come to find out that medical care, which I already knew, medical care for people with HIV, period, is different all over the world, especially here in the United States. And so it depends on which state you're in. So Kansas HIV part wasn't the problem. It was the hepatitis B. And so they have a gigantic supply of doctors who treat hepatitis C in the Kansas City metropolitan area, in the Midwest, period. But when it comes to hepatitis B, very far and few. So I had to travel to 290 miles to St. Louis, to Washington University, and become part of this study. But the only way I could see the hepatology there is I had to transfer my HIV care. So every 3 months I had to travel to Washington. And then I moved back to New York, and I'm back in the golden limelight of healthcare for any medical condition that you're going through. But hepatitis B is golden here.
Thank you so much, Jason. I think you've outlined a number of challenges that we face in caring for those who have chronic hepatitis B in the United States. You know, historically, we've always thought of hepatitis B as being predominantly an immigrant disease, where we have high prevalence in those who've immigrated from endemic areas across the world, such as Asia, such as Africa, and other areas like that. About 60% of individuals in the U.S. with hepatitis B probably are unaware of their infection. We've also seen a marked increase in the prevalence of hepatitis B as well, and not in areas where you would expect. So, for instance, in areas as diverse as Appalachian areas, Kentucky, Tennessee, areas such as Maine, not areas of the country where you would think that there's a large hepatitis B or a hepatitis B population, they've seen tremendous increases in the prevalence of hepatitis B. Much of this is likely linked to the opiate epidemic that has been contributing so much to our hepatitis C resurgence in the United States. And I think that all of these factors, combined with the idea that hepatitis B affects a diverse group of individuals, many of whom who live are in some ways marginalized in our healthcare system, contributes to why individuals are not diagnosed, and those who have it have difficulty identifying those individuals who can care for them.
Absolutely, and that's very true, because you have to remember, stigma plays the biggest role in this. It plays the biggest role. People are afraid to even talk about things like hepatitis B. And after all these years, you would think that HIV would be something we can get through, we can laugh and talk about it in the church, especially not in the Black church. So I put hepatitis B in the same stigmatized arena as mental health. When you're trying to have conversations about it, it just boggles me in this day and age how stigma still has a shine.
Yes, that all of those challenges, I think, are absolutely true, and particularly for those with hepatitis B, where not only is it U.S. citizens, but we have immigrants. Some individuals have limited proficiency in English, and you've described numerous social and cultural barriers that certainly interfere with the ability to get proper care for hepatitis B. Moreover, as we've discussed, with so many people not yet diagnosed, it's also one of the challenges we have with hepatitis B is that it's not on the radar of many healthcare providers. We need to make sure that, in particular, the frontline physicians, these are primary care providers, are able to appropriately screen individuals for hepatitis B. Our current screening guidance, Jason, is somewhat limited in that we screen by risk-based risks. That is, if you come from certain areas, if you have a family history, then you are screened. What really will help bring hepatitis B awareness to the forefront, in my opinion, is if we implement universal screening, which we don't have. Hepatitis C, Jason, we have gone from what we call risk-based screening, that is, if you injected drugs or had an abnormal liver test tested. Now we just don't ask, we treat everybody. Or we test hepatitis C, we just test for hepatitis C for everybody. I think it will take that kind of strategic approach for us to be able to identify the hepatitis B population, and then with greater identification and uniform standards for identifying people with hepatitis B, I think we're more apt to create policies, education programs, such that primary care doctors and specialists will feel comfortable taking care of, diagnosing, managing, and treating those with hepatitis B. And whereas it is wonderful that you were able to find care in Washington University for your hepatitis B, what is ideal for our hepatitis B population is that, if you will, we decentralize the care. That is, rather than you have to go get the care for hepatitis B, we bring the care to you.
That's wonderful. You know, if we can just get past the walls of stigma. It's really difficult to get through the mindset of individuals, especially in the Midwest and in the South, because they think that if you have hepatitis B at one time was considered to be just a sexually transmitted disease. So when people talk about hepatitis B, that they have it, the first thing that goes to the back of their minds is, okay, well, he or she must have been being promiscuous.
Yes, Jason. I mean, it just sounds like some of the challenges you've had have just been, if you will, just so difficult to contend with. I think part of our strategy will require us to make efforts to make sure that hepatitis B does not remain a stigmatized disease, if you will. And that's going to require education. This education, as you said, will be essentially in all parts of the United States, because hepatitis B is everywhere. It's in the Midwest, it's in the South, as you have said. It's heavy urban areas like New York. It's up in Maine. It's up in Alaska, where there's a large hepatitis B population. And so,
absolutely,
because hepatitis B falls heavily on a variety of individuals of different ethnicities and foreign-born population, we need to be able to engage these populations. I think here, community health centers are going to be key. And I think you've already mentioned this. There has been tremendous outreach in HIV, which I think can be linked to help promote awareness of hepatitis B and help prioritize funding, not only for education, but also for screening, public awareness of the disease, and for everybody to recognize that while we don't have yet a cure for hepatitis B, we actually have very effective medicines to suppress the virus that allows individuals with hepatitis B to lead normal lives. And again, there's a huge effort on moving forward right now with a great interest in trying to, once and for all, really try and treat successfully hepatitis B. And hopefully that'll happen within the next decade. I think, Jason, is one where our care and how we care for hepatitis B will have to shift to our primary care providers, in addition to the specialists who care for hepatitis B, for us to be able to, if you will, care for all the individuals who are going to diagnose with hepatitis B as we improve our screening efforts.
Yeah, that's a good idea, and it's happening even as we speak, especially when you're considering with your primary care. The problem with that I have run into, and I'm not saying this because I have a problem with it, there's a problem across the board. Like all of my doctors have pretty much been, if I go to my primary care for HIV, my doctor treats me for HIV. If I need to go to see a hepatologist for my Hep B, HBV, then they send me to a hepatologist. I've had two HIV doctors who are my primary carers who treated both my HIV and my hepatitis. The rest of them just, not that they couldn't treat, they didn't feel comfortable treating. And I was just bizarre. But when I hear about other patients who have gone to those see these same doctors who had hepatitis C, they treat them.
Yes, and I think moving forward, there are multiple efforts within the U.S. to try and educate primary care providers. I'm here in California, Jason, and I would tell you here, our primary care providers here are quite skilled in caring for those with hepatitis B, recognizing how to monitor these individuals, how to make sure family members are identified and vaccinated to prevent the spread of hepatitis B. And they also monitor and are able to refer when they think treatment might be appropriate. Some of our hepatitis B patients are actually cared for and treated by our primary care physicians and just cared for just very capably. And what we hope is that with better education, that we can continue to, if you will, decentralize this so that we'll be able to offer hepatitis B care for individuals regardless of where they reside within the United States. One of the effects of the COVID pandemic, which, as you know, disrupted everybody's life, is we rapidly transitioned to telehealth. And I think that we should be able to leverage some of these care paradigms, these models of care that have had to evolve very abruptly, and continue to use these to extend our care for other diseases. And clearly, viral hepatitis, HIV, there are a variety of diseases, I think, that we can successfully manage with these approaches and allow individuals such as yourself to receive the care they need without too much disruption, without too much travel. And again, as you have so eloquently stated, also by being able to make these resources available, we can begin to reduce the stigma associated with a diagnosis of hepatitis B. Because again, this is the most common bloodborne infection in the world. We have the tools to care for individuals. We now need to create the knowledge base and the infrastructure to allow all of these individuals the opportunity to be diagnosed and appropriately linked to care.
I already started when I was in Kansas doing public speaking. The Hepatitis B Foundation, which I know you guys are very instrumental in propelling everything forward. They flew us out to California doing the Storyteller campaign, the Just Be campaign, but there's a lot of work that goes along with it, a lot of internal work. And I was able to do it. And I realized this video isn't about me. It's about a whole world filled with fear, filled with no voice. And my story can be very instrumental in waking some people up on the inside to let them know that all stigma is just something someone put out there that just isn't true, and that it's okay to talk of. And so that has been pretty much my time for my life, period. I love being able to help people with my story, with my experience. Some people know I'm a minister and some people don't. And I don't go out and profess it. I keep one thing in its place and the other thing is up in its place. And I'm never going to stop advocacy. Even if we find a cure, when we find a cure, I'm still not going to stop advocacy. Because there are certain people in this country who are just locked out. And, I fear that if I can't help one person, then I fail. I suffered depression and I almost killed myself. I suffered depression. My virus wasn't going down fast enough. And, I was one of those that believed in the hepatitis B, which is a trip. I never heard nothing about it. And then the doctor that I had only had biologic hepatitis C. And so it was really difficult. And I didn't know how to get through it. And so it took faith. It took positive people It helped me out. And once I came out, I swore I would never go back in it again. But not only that, I would make sure that, I can help others to avoid going there by joining the Hepatitis B Foundation, by joining the fight, to give them my thoughts so that other patients can know there's hope.
Sure. Who in your life, Jason, have you had people who've helped you as well? Just
Yes, my husband, my cousin Rocky, and my sister Dawn.
Yeah, I think that's so important that we all have a community. And it's great that you're working with the foundation, Jason, because I think to beat this disease, it really will take a village.
Yes. Mm-hmm. Absolutely.
And how are you now? Are you more optimistic?
Oh yeah, now I'm fine. I'm great. I'm in the high of my life. And I'm not one to, in this day and age, to complain. I'm really grateful.
Just so noble that you've now committed a substantial part of your life to making sure that others with hepatitis B can lead normal and happy lives.
Mm-hmm. Yep. I do recommend speaking with their doctor, see if they have other patients who are willing to speak with other patients, maybe form a little circle in their community, because there's power in numbers, and see how that goes. If not, then just search for, go to your health department, local area health department, and see if there are any resources that would allow you to meet other people with hepatitis B.
Jason, thank you so much for so openly sharing your story and what are some deeply personal challenges that you've had to overcome. It's great to see that you are in a much more hopeful state now, and that you've learned not only to manage your own challenges, but you're working to make sure that others with hepatitis B can benefit from all of the experiences that you've had to contend with in your journey. We hope as physicians that we can create the infrastructure so that people such as you and others infected with hepatitis B, as well as other diseases, are able to easily discuss their medical challenges without fear of stigmatization, and most importantly, also be able to get the care you need wherever you wish to go in the U.S.
Thank you very much for being an instrumental part in your community, that treating patients, giving them that relief of knowing that they have someone they can go to for health care. I am grateful to have this opportunity to speak with you about the ups and the downs of living with hepatitis C.
Thank you, Jason and Paul, for speaking with us today, and thank you for listening. Look out for more episodes in this series at clinicaloptions.com/hepatitis.